Okay.
Okay, well, hi everyone and welcome. This is Lisa Blaisdell, the founder of the World Health Summit, and I am so excited to be speaking with Dr. Druz I'm in Rhode Island, in Long Island, New York. And Doctor, I love what you're all about, what you're doing back there as it relates to heart disease and helping patients. And I read a little bit about your background, but I would love for you to share with the people watching this your story. How did you get to this place of functional medicine?
Well, Lisa, thank you. First of all, thank you so much for having me. Second of all, question is, do you want a short version or a longer version? So perhaps we'll go with the shorter version.
Okay.
It's not new in cardiology that lifestyle obviously has a major impact on our patients, and actually, and the very fact that lifestyle could prevent majority of vascular diseases.
Yeah.
I think for me personally, it was a specific time point, a series of observations, being involved clinically with my patients and being in a large healthcare system where we had obviously a lot of patients and a lot of illness and a lot of procedures. And it became obvious at some point that as great as those procedures were, something was missing. There was a missing link.
Yeah.
And nobody really seemed to know what that missing link was. And yet it was obvious, it was there in the plain sight. There were certainly patients that I interacted with that seemed to have a much fuller quality of life than perhaps similar patients with similar disease burden who really didn't do as well. And it wasn't purely medical. It was really about lifestyle choices, about their outlook, about their attitudes, their philosophy of life, and the focus that they had on themselves doing well and doing everything they could to do for themselves to be well, versus a group of patients who just felt that they were powerless in making all of these decisions, and they were just, stuck in a big medical, expensive, complicated machine.
Yeah.
So that, I think, would be a shorter answer than a longer answer.
No, that's awesome, and I love that that you have taken a role and a proactive stance in empowering people and giving them their power back in terms of taking control of their situation, whether they're going down a disease path or they want to prevent that altogether. Because what I've learned in this, work, which isn't the same, but it's around helping people be healthy, is that it's just really about helping people have that empowering attitude towards it.
That is very true. Very often my patients, they would tell me, well, you did it. You helped me to do this, or you helped me to do that. And my usual answer is that actually you did it. I was just there to guide you to the right places and the right interventions. But
Right.
would have never happened if that particular individual, you as a patient, didn't make a decision that this is what they want to do. And in many ways, it's an opportunity for patients, for individuals to be in control of their destiny, to do the amount that we can potentially be in control of anything. But it's a very different mindset versus just being a patient and, accepting treatments as inevitable, accepting aging as inevitable. This is a much more different mindset, much more proactive, and certainly something that a lot of patients enjoy, that realization that they do have choices, that they do have power.
Yep. Absolutely. So give me an example of what you in your practice with your team will do to help someone that maybe is starting down the path of having some cardiovascular issues, whether it's just, I don't know, maybe their weight isn't where they want it to be, or they're having some, palpitations, or maybe they're from a family with some higher risk factors. What do you do with a patient that comes to you and is looking to get more proactive and wants to go down a path with you and your team?
So a great question, actually, because you just probably described our top 3 or 4 patient categories. But this is the most common opportunity that I have together with my nutritionist and lifestyle coaches, really work with a patient who is beginning to understand that they have certain conditions.
Yeah.
And often we get patients at various stages. Sometimes they already had cardiac events. They may have had their heart attacks. They may have even gone through cardiac stenting or bypass surgery or more advanced therapies that were, of course, indicated and necessary at the time when they had an acute event. And sometimes, fortunately, they're not there yet, but they are kind of in early stages where they're first noting that blood pressure is high. They're first noting that they're gaining weight. They are noting that they're not sleeping. They are puzzled as to why their blood work that used to be normal all of a sudden starts to drift south, if you will, and the number starts to fall out of range. And what I find, as different as these patient groups might be, the most important part of what I do and people who work with me do is that we provide an opportunity for these patients to understand that illness and wellness are not dichotomous entities, right? And you know this probably from your practice. It's a continuous arc, if you will, that an individual starts preconception and then, of course, goes through conception and at birth. And as they come into the world, through the continuous interaction of genetics and environment and all the other factors, we are traveling on that arc and that road where illness and wellness actually coexist. And at any given time, we in many ways could define, are we more well as opposed to ill? And that's really an opportunity for us to give this patient hope and also make them understand that there are a lot of what they can do, that it isn't necessarily some sort of a verdict that is irreversible, that let's say right now they have coronary disease and they got their stents and they got their medications and this is it. This isn't the end. This is actually the beginning.
Right.
And it is that repositioning that I think is very vital for a patient, because it then enables them to understand everything else. And typically we proceed to find what are the root causes of the vascular issues. I am a functional medicine practitioner, so for me, root causes are always number one. We do the full spectrum functional medicine, which is very helpful. And the patients actually come to understand the real influences and imbalances that are specific to their situation and how they can correct it through lifestyle modification.
That's awesome. Yeah. And I love that you say that it's, really getting the mindset around the fact that although there may be illness that's existing, there's still a lot of wellness, and that you're really taking them through this journey to get to that end result of all wellness. So tell me about the role that nutrition and diet plays in your practice. And do you have any particular one-size-fits-all methodology, or do you take it on a case-by-case basis depending on the existing lifestyle and diet of your patient?
So great question. Actually, I kind of gravitate to what I would call the least common denominator in the initial nutritional intervention. And based on the functional medicine paradigm, I would say 90+% of the time, it happens to be an elimination diet. What we change, of course, is the duration of it, although we try to stick more or less to 30 days if possible. There is, of course, a possibility to modify it. Some of my patients, we know already that they're not necessarily food sensitive to certain things, so that doesn't make a whole lot of sense to exclude them because they actually like and enjoy eating them. But of course, we exclude all sugar and everything which is processed, all the gluten and all the unhealthy artificial additives. Certainly exclude alcohol and limit and try to exclude caffeine most of the time, although I find that that's the most difficult one.
Isn't it though? Isn't that though?
Is
It's
the
just
most
amazing
difficult
to me.
one.
Yep. Yep.
And so that's, while we strive to do this, occasionally we allow a little cheating with that, because one still has to maintain, some control over
Right.
that period. And what I find is that this approach sort of resets a patient, and in a way, it's hugely detoxifying. It calms a lot of inflammation. It allows them to really stay focused, because they enjoy the fact that they're not limited by calories, but they understand that they're limited in food choices, and that's deliberate. And what's more, they learn to be more mindful of what it is they actually eat, because they have to track it and we have to see it. And hopefully, I find that a lot of functional medicine experts do push for nearly perfect compliance. I find that in clinical practice, if they're there 70% of the time, they will have a good outcome.
Right.
So and that's, it gives them about a 30% chance to be maybe not so great.
Right. No, that's great, because that is the reality of what most people are, their lives. I mean, it's just, it's hard to have this extreme change, especially if they're coming to you and their diet is part of the reason why they're having some of these health issues. So, I think that that's great. So then after the 30 days, then do you kind of assess, where they're at and where there might be sensitivities or issues? And do you have a particular protocol that you will then implement after you kind of see what's been going on and what's been working for them?
Exactly. So that's, so usually following 30 days, we of course do a reintroduction of the foods. And I should mention that I do use medical foods quite a bit during the elimination phase. Usually they're pure, organic, non-GMO. They have fairly high protein content. They have fiber. And the modifications that occur in many regards are not just depending on how a particular patient did with the elimination protocol, but what we find based on advanced blood work, on their genetic analysis, on their questionnaires, and their saliva profiles, because what we really try to do is to address the metabolic, hormonal, hereditary, inflammatory, toxic, and stress-induced imbalances that every individual demonstrates to a certain degree. And so the next phase very often varies depending on the outcome of this information. So in most scenarios, coming off elimination and going into successful reintroduction, I either put a patient on what we call a cardiometabolic plan, which is the functional medicine plan that is most similar to Mediterranean diet, as most people know it.
Yeah.
Or in cases, for example, of insulin resistance, or patient is significantly inflamed or overweight, I actually prefer Mitoplan, which is in essence a mild variation of ketogenic diet. So that kind of, it splits into this fork in the road, if you will, and what I find very often is that a lot of my patients who don't appear to be overweight, they might actually be metabolically obese, because we do a lot of body composition. And so it's really isn't the weight loss that we're looking at. We're looking more at the fat loss and rebuilding of their muscles, so changing their body composition.
Right.
And once we do that, they certainly experience huge relief in terms of insulin resistance and a lot of other components. And there's some tweaking that goes on into it depending on their genetic profiles. While I do love, genetic information, I feel that at this point it's more of a secondary, tertiary layer of intervention. It's certainly not the primary, because it's difficult to say that, well, here's this individual and that's their blueprint, and without the labs or the physical exam or the history of the questionnaires, based all of your interventions based on that blueprint is just not clinically making sense.
Right. No, I love that. And I was going to ask you about the Mediterranean diet. So I'm glad that you brought that up, because cardiologists, and heart disease is synonymous with the Mediterranean diet, and it's I'm never sure if that's really what practitioners like yourself do believe in and support, because there's so many different protocols that people can be following, from plant-based diets to the ketogenic diet to so many different variations of that. So I love that. Boy, you're incredibly thorough, Dr. Druz. I'm just so impressed with the depth of which you really study each patient and ensure that they have a protocol that's going to suit their needs the best. It's incredible.
Thank you.
Yeah. So it's just, really, the only other question that I've been asking, which is kind of a big sort of overriding complicated question, I realize, but I'm just so fascinated with this topic. But what do you think the biggest challenge is in educating the population, society, your particular community, around the role that lifestyle, nutrition, mindfulness, the toxicity that we have, etc., as it relates to our health? What do you think the biggest challenges we have as a society, knowing that, heart disease is on the rise, cancers are on the rise, all these things are happening, and yet we've got so much information at our fingertips? Where do you think the challenges are, and what's your approach to try to really combat this crisis that we have?
So, Lisa, first of all, fantastic question, and no easy answer to the question. But I will separate it into two parts. The first part, and I guess the major problem, is that over time, as medical professionals, the way that we were introduced and the way that the practice developed, at least in this country, left very little room for lifestyle medicine, right? It is so much easier for insurance companies to evaluate you based on your record of prescriptions or satisfaction of guidelines or how well a particular drug reduces cholesterol. And because it's so much more difficult to apply the same framework, if you will, to lifestyle intervention. And there is a reason for it, because lifestyle intervention is certainly more heterogeneous. It works much more upstream as opposed to downstream, where drugs and procedures work. And so it's much more difficult to quantify. There's a lot of personal variability, and the outcomes are not as easy to measure. That, interestingly enough, is changing, because modern technology right now, with the diffusion of technology, let's say mobile health tools and activity trackers and various platforms that, for example, help patients to obtain nutritional advice on a daily basis and actually record what a patient may be doing, we are positioned in many ways to change that, to actually provide some type of a quantifiable measurement, despite diverse patient population, for lifestyle intervention. However, the medical system as it's structured currently has very, very little room for it. Yeah. And yet at the same time, and that's the second issue, we have consistently mounting evidence that lifestyle intervention is very helpful pretty much for anything, certainly for chronic diseases such as, heart and vascular disease, dementia, and cancer. Right. And the studies are out there, the protocols are out there, but because the effort was never really guided by rigorous outcome and measures, we have to consistently try to separate the noise from useful information. Right. And that's where the difficulty comes in, because I'm sure you may be getting the same type of inquiries that I often get, patients who have come and, and know it all because they done their research. And for example, they come into my office and say, well, I've been doing the keto diet and I know I have heart disease, but I know that's the best for me to do. And I would say, well, how do you know this? What is the measurement, objective measurement measurement that tells you and I that your approach is successful, other than you losing weight, which, will, commonly happen with a lot of people in the keto diet, at least up to the point. How do we know that it's safe? What are the goals that we're trying to accomplish? And this is where I think we as practitioners have a real opportunity. And it's a hard opportunity because we have to teach our patients that not everything they read or hear or research is actually something that is relevant to them, that the information is heterogeneous, that some of it is valid and some of it may not be valid, or certainly may not be valid to their particular case. And so unlike the drugs, and I like the interventions that come more downstream, that are easier to measure and quantify and assign the benefit to a specific patient group, it's so much harder to do it with lifestyle intervention. Yeah. So I would say that, what I try to, imprint, or at least to develop in my patients, is this ability to understand that there are subjective and objective goals to success. Right. There are things that are supported by evidence and research that we have, and sometimes we don't know all the answers, but to the extent possible, we are able to measure the outcomes, and that's really our goal.
Yeah, I love it. I love it. No, you're absolutely right. And I think the information age has been both beneficial and also challenging, as you just referenced, in people coming to their own conclusions about what's best for them just because they read it on the internet. So we do have more work to do there. So I know we're getting towards the top of the hour and it's late there, and I don't want to take too much of your time, but you have so much incredible information to offer. How can people find you, and how can they continue to learn from you and get to know your practice, and even, refer them to your practice, even if they don't live in your area, Dr. Druz?
Well, thank you. So if they live in our area, we're located in New York, so they can easily get in touch with us. The practice name is Integrative Cardiology, PLLC, or they can look us up on the internet at iccli.com. And that is the local practice. But just as you mentioned, a lot of patients are actually not local. And for that reason, and a lot of my colleagues and my teammates are actually not local. So for that reason, I had recently formed a network, and it's called Holistic Heart Centers of America. It's a networking platform that also allows us to engage patients in virtual interactions that are completely HIPAA compliant, from one-to-one sessions to group classes. And we are working on becoming national and global, and to bring practitioners in who have the expertise, who have the skills, and who are truly able to work with patients and give them the right information that will be of help to them. So both ways are good, and they'll find
awesome. It. Oh, wow. So it's Holistic Heart Center of America.
Right. So if they go to holisticheartcenter.com, they will find us, or iccli.com is actually my local practice for patients who typically visit us on site in New York.
Well, that is exciting, Dr. Druz, because certainly what you have to offer should not just be limited to the people who live in the New York area. So I can't wait to check that out and to share that resource with our community as well. So I just want to thank you so much. You are just an incredible gift of education, and obviously you have a huge heart to serve people and help them in this way. And heart disease has impacted my family, as it has most families. So I'm just so indebted to women like you and people who are so willing to work every day to really help people have options and empower their patients. So thank you so much, Dr. Druz. I look forward to staying connected to you, and thank you for staying up late to talk to me.
Thank you so much for giving me this opportunity. I hope that your patients, your community finds it useful. Any questions are welcome. I always tell my patients that I learn more from them than they actually learn from me.
I love that attitude. You have a great attitude. Well, thank you so much, Dr. Druz, and you have a wonderful night.
You too. Be well, Lisa.
Okay, good night.
Good night.